Okay. Hello, everyone. Hello to the people in the room and anyone who's live. My name is Joanna, and I am a pharmacist here at Summit. I have been a pharmacist working for about almost a decade, and I work in the ambulatory care or primary care space. So, did you guys know that there are pharmacists in clinic, like up with your providers? Have you met with one before? Okay, perfect. So you did know that. But a lot of people don't know that there's a pharmacist who often sits up in clinic with primary care providers. But that's what I do, and we help manage chronic disease states that need a lot of med adjustments like diabetes. We help a lot with medication access, so helping patients get the meds they need, and also we help a lot with just organizing meds. That's my mom. She came to listen too. So I recently moved back to the area. I'm from Montesano, but I have lived across the country for the last 15 or so years, but moved back to be closer to family, so very happy to be here. And talk to you today about all things medication management, and talk a little bit about some tips to help manage your meds a little bit easier, and hopefully help set you up for success. Because it can be complicated, even for us. So, let's see. Oops. Let's try that. Should have tested. Oh, wait, here we go. Okay, so overview today, we're going to talk about tips for managing meds, a little bit about over-the-counter or OTC safety, talk a little bit about communication between the doctor's office and the pharmacy and other healthcare professionals, and then dip into insurance coverage for meds, which can be probably the most confusing part. And a lot of folks, even a lot of providers, don't really understand how it all works. Even I don't always understand how it all works. So it's a very complicated field, but I'll try to simplify it a little bit. Okay, so first section, managing medications. So we, as a group of people, there are a lot of meds out there, and people are on a lot of meds. And a lot of folks, there's just a lot of disconnect often about how to take your meds every day and how to follow all the instructions and take meds with success. Half of filled medications are not taken as they are intended to be taken. 67% of older adults, so those over 65, are on 5 or more meds. So a lot of older adults are on a lot of meds. Adherence rate to chronic medications is as low as 50%. So that means taking your meds every day as you're supposed to. Less than 50% of meds are taken correctly. And 2/3 of medication-related hospitalizations are due to poor medication adherence. So it is. People get on a lot of meds, and it's hard to take them as they're supposed to be taken. And a lot of that is accident. People just don't realize that they're not taking them correctly, or they forget. Some of their meds, just trying to keep track of everything. There's a lot of reasons for that. So we'll talk about that today. But managing meds is a big problem, and one that we really want to help improve. So some tips to managing medication successfully. So one thing I always like to remind people is try to help take responsibility for your meds. Because ultimately you're the one putting these in your body. So I always want patients to feel like they understand what they're doing, they know why they're doing it, And so I always like to encourage patients to take responsibility. Hello, welcome in, and we're just getting started. So ways that you can do that is one, keeping an up-to-date medication list for yourself. Thinking about reminder tools to help you remember how to take your meds. Make sure you know about the medication you're taking, what they're for, why you're taking it, what are some of the possible side effects. And also always asking to simplify your list is really important. Because a lot of times things get added on, and as you move through the healthcare system, you end up seeing, different providers and reasons that meds were added 20 years ago. It's hard to track that, so people don't like to stop meds because they're worried that if they stop it, something will go wrong. So they just keep adding on top, but the next thing you know, you're on 20 meds and you don't know why you're on half of them. And your provider doesn't even sometimes know why you're on half of them. So always taking a moment to stop and think, hey, can we take a look at this? And is there something we can do to reduce this list? Because I feel like I'm on a lot. And that's often where the pharmacist in clinic can be very helpful, because we can take a lot of time to go over each medicine with you, dig through your records to try to find when things got started, why they got started, and then try to work as a team with your provider and other healthcare professionals to start simplifying things. So those are some overarching tips that to keep in mind as you're looking at your med list. So raise your hand if you have a medication on you or with you right now, or if you just carry one around generally. Okay, that's good. If you don't have one now with you, do you have one at home? Okay, so that you keep it home. Perfect. That's very important to help keep track of your meds. So I help people make their own med lists, but there are lots of different features online or ways to make a med list, and I don't really care how you organize it, whatever makes sense, but I do think there needs to be some things that you're tracking on that list. So first, so this is just one example, but a lot of patients will use their own Excel or Word document that they've created, or some people come to me with file folders full of meds, or not full of meds, but full of lists that they've kept for each med. But you want to include all your medications, and that includes over-the-counters and supplements, everything that you're taking. You want to know what the dose is. So is it 1 tablet? Is it 2 tablets? So you want to know what the dose is. And that's my dad. Hi, Dad. That's what happens when you live in a small town.
Maybe for the rest of the crew.
So you want to know the dose, and you want to know how you're taking it. Are you taking it by mouth? Are you giving an injection? Are you taking it with food? Are you taking it once a day or twice a day? So that needs to be on your list. Something that's helpful to keep track of that a lot of people don't is, when did you originally start this medication? And then if a medication was stopped, when was it stopped? And why? And that's something that you could keep, maybe not on your active med list, but, just keep track of that on another sheet or in the file somewhere. Who was prescribing it? Because a lot of people, how many of you guys see multiple providers? Yeah. And how many of those providers are all in the same system?
Yeah.
Yes, which it helps now with our electronic health record that we have, that we can see stuff from other providers, but a lot of times they're not in the same system, so it can be hard to track down records and what was done in other appointments. So making sure you know who's prescribing the med is important. Also, why you're taking it. How many of you guys know why you're on each med that you're on? Oh, good. You guys are great. Perfect. A lot of people don't, and it gets really hard when you're on 15, 20 meds to remember. I mean, that, I get it. It's hard to remember, so that's why keeping it on your list is important. And then if you have any allergies or reactions to meds, that's helpful to keep track of. And I'll just point out here that not all reactions to meds are an allergy. So a lot of times they're just side effects. But keeping that reaction, knowing what happened, and keeping that information is important. And you want to take it to all your appointments and update it with any changes. So if you saw a cardiologist and they made a change, make sure to update your list and then come to your primary care provider and have that list up to date so they can, hopefully they'll have known about that change, but sometimes the records don't get passed through or it takes longer to get them, so it can be hard. So those are important features to keep track of, and I encourage you to do the best you can doing that. Okay. So this question I get all the time. Well, you should know what I have. You should know what I'm taking. It's on my list. Or why is my list incorrect? I get that question a lot. And so I've kind of alluded to that before, but we have so much information now, which is great. But we also, it can be hard to organize it. And we also have doctors at different facilities making changes. And if it's not in the same system, it can be harder to track down. Or maybe we do track it down, but then it doesn't get entered in the right place in the chart, which can happen. So there can be lack of communication between health records. There are numerous people that touch the med list. So medical assistants, nurses, different providers, me, different, pharmacists. And so sometimes, and there's limitations with our charting. So sometimes you might tell someone, oh, I'm not taking this. And they might make a mark that you're not taking it, but then it never actually gets totally removed because someone else has to remove it. And so there's some limitations with charting that can cause updates to the med list to not fully carry through. And then, of course, we have different people prescribing things, so they're touching the med list all the time. And then different care transitions, so you go in and out of the hospital, and that's a big time that things get changed. And because meds get changed in the hospital, sometimes they get changed to different agents because the hospital only has certain meds, and then they don't get changed back on the med list when you leave. And so those things get carried over. So there's just multiple times when the med list can get adjusted by different people, and it might not end up matching what you're actually doing. There's a lot of times I change a med list and I have it all perfect, and then they go somewhere else, and someone changes things, and then it's off again. And also automatic refill requests. So a lot of times people sign up for automatic refills, which is great with your pharmacy, and then sometimes the pharmacy will automatically request refills from us, but they might be on meds that were discontinued. I've seen this happen, and then the med gets added back to the med list because of this automatic request. And
Oh, wow.
yeah. So there's just a lot of different ways. Technology is awesome and it's made things very easy and easier and better in a lot of ways, but it also can make it harder to track and easier for things to get adjusted and changed. So just know that we work really hard to try to make sure every visit that we go through your med and the med list is up to date, but sometimes it just, with so many changes and people touching things, it gets out of date quick. So just know that that can happen, and that's why we try to be diligent to track things down and keep things up to date. Okay, so besides the med list, what other tools do you use to manage your medications?
I have pill boxes.
I love a pill box. Okay, great. Pill boxes. Anything else? Yes? Beth?
Well, I keep a list of all my medications on my phone.
Oh, nice, a
So
phone
it's
app,
under-
or just on the phone?
on my notes on my iPhone. So every time I go to the doctor, depending where I go, I have to fill that list out again. It frustrates me because I was here 3 months ago, and I gotta do the same thing over again. I didn't change anything. Go through the list. But having that on my phone saves me so much time. And the other thing, it's not meds, but it's all my surgical history.
Yeah.
They want you to know that. So I just have another spot in my phone and all the dates. And I just-
Yeah, that's important,
If you
because
do that, it just saves you a lot of heartache, at least for me, and a ton of time, and it's more accurate, so.
yeah, keeping a list on your phone and using one of the apps or just notes in your phone can be really helpful. And yeah, it's hard to track that stuff down sometimes in the chart. It can take a lot of time. Yes.
Sometimes I'll recommend to individuals who have trouble to remember to take a certain med at a certain time, to actually use their phone, set an alarm, and that helps some people.
Yeah, phone alarms, that's another great option.
I do that.
Yeah. Yes.
Or I use my little toolbox, like you were saying, I have my weekly AM, PM.
Yeah.
And the problem is, I'll travel, and just go to work, and I'll like have 4 pillboxes, and I'm gone for a month, you know, but, so then you have to go out and get advanced prescription refills.
Yes.
But it just keeps me, if I don't have that, I'm lost, I don't know what I'm taking.
That's hard though, when you run out of prescription and I have to write a little note to say I need to have this refilled on this day, this day, this day, the time, and then cross it off when I finally get it. That separation to go out 2 weeks is sometimes more confusing than just one day at a time.
Yeah, I get that. And I do have a possible fix for some of that, the refill stuff too, but we'll talk about that later on. So yeah, I love pill boxes are awesome, keeping lists on your phone, using your phone as an alarm, or using your phone alarms to remind you to take your meds each day, or maybe your insulin injections, if you're on insulin, I use that a lot for patients. So those are all really great tools to use. So here's some other tools I came up with that I use a lot. So we talked about the medication list. We talked about kind of calendar reminders on your phone. I have in the past, for patients who aren't as savvy with their phone, I've printed out just a month calendar, or you can use just a paper calendar that you buy and just have them put like a check mark each day when they take their meds, so they know, and then they can look back and like, oh, I didn't check that day. I must not have taken my meds. The pill boxes, like we talked about, you can, this one in the picture has 4 slots per day, but you can get one with 1 slot per day, 2 slots per day, lots of different options for a pill box. There's also compliance packaging, which is a term I use when pharmacies will package all your meds in a bubble pack or a strip pack. So that would a bubble pack would look like this. So you have a bubble for each time of day with all the pills for that time in it. So it's kind of like a pill box but you don't do it, the pharmacy does it. And then the pharmacies will also do this thing called a strip pack, which is basically the same idea, but you have one little pack for each time of day, and then you rip it off, you take it, and then the next time of day will be ready for you when it's that time. So our local pharmacy here in Alma does compliance packaging, and they do strip packs like that. They do it at the McClary Pharmacy, but we'll deliver it to Alma Pharmacy for patients to pick up. So these are very helpful when you are on a number of meds and they're pretty stable, and it just saves you time for filling a pill box. It can be a little bit hard if you're in the middle of having a lot of adjustments to your meds, because they usually will fill these a month at a time. And then if there's a change, you have to be able to identify the pill in each of the little foil pouches and like take it out, or yes.
They do over-the-counter things that you might want to include, like I take omega-3 or a vitamin. Does that get put in that?
Yep.
Kind of package too? No?
Yeah. So they'll put OTCs in there if you want. You'll just have to buy the bottle and then give it to them, and they'll usually will put it in there. Sometimes there's a space problem, like omega-3s are big, so they can't always fill up. But if you do like a strip pack like that, there's a little more room. But you could see like here, it starts to get full. So, but yes, they do. And for a lot of patients who I have important OTCs that I really want to make sure they take, like maybe they have osteoporosis and I need them to be taking their vitamin D and calcium, I'll have them put it in the pack. Or baby aspirin, I'll have them put it in the pack. So it just makes it a lot easier. As needed meds obviously wouldn't go in the pack. So you'd have to keep those out. So those are really nice. And then they also make pillboxes that alarm and lock. So I've used this, this is very helpful for caregivers who might care for patients with memory problems, like dementia. And the caregiver can fill the pillbox, and then it locks, and then set the times if they want the patient to take the med, and then it'll open just that slot at a particular time, so the patient can take that dose and not get confused about which pillbox slot they're supposed to open or which bubble they're supposed to take. So I've used those for some patients and they're helpful. And then we talked a little bit about your phone and using phone apps. There's a lot of apps. I don't have any particular one right now that I recommend, but there are a lot of phone apps for meds that people use that can be helpful. So those are some tools. Any questions about that? Okay, so imagine this scenario. Your provider prescribes an antibiotic to be taken for 10 days, but you start feeling pretty darn good after 5 days. What should you do?
You keep taking it.
I would keep taking it. Any other thoughts? Huh?
Better take it and never goes away.
Yeah. So, the answer is you should continue to take it. Because, in particular, antibiotics are we prescribe very particular durations of therapy based on studies that show what's needed to clear the infection. And a lot of times people start feeling good and a lot better earlier, but the bacteria might not be totally cleared from your system. So if you stop taking it early, not all the bacteria is dead, and then it won't have any antibiotic anymore, so it'll start growing again. But now it's going to be smarter and start to become resistant, and then we'll have to find another antibiotic to use, and that gets messy. So with antibiotics in particular, you always want to follow the directions. Now, that's not to say if you're not tolerating the antibiotic, then you definitely need to call us, because I never want patients to feel like they have to be taking this medicine that's causing a problem. So always let us know if something's causing a problem, but in general, you want to follow instructions. So take your medicine as directed. Always check the label. And double check, maybe you've been taking a medicine for a long time and there was a change in the dose or something. Just always double check the label, because when I have patients come and see me, I always make them bring their pill box. I always make them bring all their pill bottles so that I can check that what they're putting in their pill box, what they're taking is matching what's on their bottle. And just earlier this week, I had a patient come in and she brought all her bottles and we were going over, and one of the meds was written for twice a day. And she's like, oh, I'm taking that once a day. I'm like, you're taking it once a day? And we look at her pill bottle and it says twice a day. And she's like, oh my gosh, I never recognized that said twice a day. So always, and sometimes we change things. We might start out once a day, like this isn't really working for you, so let's change it to twice a day. So it's always important to double check the label and make sure you're taking it as prescribed. The other thing that I want to point out is watch for old directions. Kind of like in the scenario I just stated, a lot of patients will have been taking it so long that they don't recognize if we change the direction from once a day to twice a day, or maybe we change back to it like, from twice a day to once a day, and then they didn't check the label because they're so used to taking it in a certain way, and they end up taking it wrong. And then it won't have the effect that we hope that it has. Always talk to your provider or pharmacist if you have trouble taking something as directed. So if you have a medication that's written for twice a day and you just never remember that second dose, you just can't remember, let us know. And we can often change it to something that will work better for you. We can find an alternative agent that's just once a day, or change something in your regimen to work for you. So just always tell us how you're doing. Yes.
So I got a better question. So on the bottle, it tells you, the dosage once a day, twice a day, how many pills, and each time you take it. There's other instructions that say take your food, take it on an empty stomach, or whatever the case may be. That's harder for me to follow because I have a routine. I'm not eating now, but I need to take a pill now. Am I causing myself? And I've never gotten ill. I don't feel any side effects. What could I potentially be doing by not following those detailed instructions? What kind of conditions your stomach be in?
Yeah. So that's a good question. So following those alerts that the pharmacist often puts on the bottle about taking meds with food, taking on an empty stomach, how important is that? So it depends, and I will say it depends on the med. There's a lot of meds that we say take with food because it could upset your stomach without food. And an example I think of is metformin. I always tell people to take metformin with food because it could upset their stomach more if they take it on an empty stomach. But if they tolerate it without food, then I don't really care. Take it without food. Question?
Yes, I've taken medicine that, I clump them together, but once a day, but one of them says on the bottle, take it, if you take this medication with this medication, they have to be so many hours apart. How important is that?
That can be pretty important, and they usually will say that for meds that might have, like their absorption is affected by food or dairy or other types of things like that that will affect its absorption. So it is good to separate if you can, to the best of your ability. Sometimes it's just not possible to do things totally perfect, but there are meds, like a thyroid medicine is really best absorbed on an empty stomach. And I do tell patients to try to do it on an empty stomach if possible. But we're also titrating a lot of meds to effect. So if the decision is like, oh, I have to take this on an empty, I'm going to keep missing the dose because I just cannot remember to take it on this time, versus, well, if I take it with all my other meds, I'll at least remember to get it in every day, and then we can kind of titrate to effect. That's okay. So, I'm trying to think of a med that really needs to be taken on an empty stomach. So anyway, there is some, if it's an absorption issue, then it's best to take it on how it's prescribed to get the most drug. If it's a side effect issue, then if you're tolerating it without food, then it's fine. And to know that, you can really just ask your doctor or your pharmacist, do I really need to take this on an empty stomach? It doesn't bother me. Or with food, it doesn't bother me. And they can tell you. So it kind of depends. But my first priority is that you're getting the med in and taking it and at least giving some effect. And you can go from there. Okay. And then the other thing, cost. Please tell us if cost or side effects limit use. I cannot tell you how many patients I come across who have terrible diarrhea from like metformin, to the point that they sometimes are going to see a specialist for it. And all I had to do was like stop the med. Or I have patients who they've had terrible side effect, bothersome. I think of metformin a lot because this comes up all the time. And it's like, well, metformin can cause diarrhea. Or I will ask, have you ever told your provider, anyone, that you're having this issue? no. Like, I don't want you to live uncomfortably. Like, tell us if you're having a problem and we can try to fix it. Or if there's a cost issue, tell us. I never want a patient to pay an exorbitant amount for a med. So if it's causing you stress to pay for a med, tell us. We can try. There's a lot of options for us to try to get something affordable for you. So always communicate if you're having problems, if you can't take something the way you prescribed it. Never feel like it's a failure or anything. We want to work with you. Everyone's different, and we can find a regimen that works. Okay, so disposing of unused medications. I think this is also really important because it gets very confusing to have a bunch of old meds around to remember which one you're supposed to take. It also can be a safety issue if other people get into your meds and take them. So you want to get rid of old meds. So there's drop boxes in a lot of pharmacies that you can throw meds into, including right out here in our pharmacy here. There's a drop box. I learned this in Washington State. There's a mail back program for meds. So you can call this number or go to that website, and they will send you an envelope that you can put your meds in and mail back. So that was kind of nifty. And then this isn't preferred, but if you have no other option for getting rid of meds, there are these 4 steps to take that you can dispose of them in the trash. So you want to mix with an inedible substance like coffee grounds. Put the mixture in a sealed container, like a Ziploc bag, and then throw the container in the trash, and then recycle your bottle, and get all your information, scratch out or rip off the label so your personal info isn't in the trash. So those are a few ways in Washington to get rid of meds. But I highly encourage people to get rid of meds. I used to do home visits, and sometimes it was just so interesting to go to people's homes and open a few cabinets, and there's just stacks of meds, of old meds. I'm like, what are you doing? Yes.
Do some meds change state, meaning they were effective within the prior to the expiration date, when there's an expiration date, do they change states, and do they actually do harm by taking older medicines?
There are some, in particular antibiotics, that can become harmful if they've expired. Most meds, it just becomes less effective, but there are some that, in particular like tetracycline antibiotics, that can become harmful if they're expired. So that's important to note. Okay, any questions about that? Okay, let's talk about OTCs. I'm gonna move a little faster because I want to get to the med coverage stuff because that's the most confusing. But OTC safety reminder: always tell your provider what you're taking over the counter. If you're having a problem that you need an OTC medicine, let's say stomach upset, and you're taking Prilosec over the counter. If the problem persists more than a couple weeks, then let your provider know because we might need to do something different for you. If you have liver or kidney disease, always check with your provider because even over-the-counter meds that a lot of people consider safe can be harmful if your kidneys aren't getting rid of drug properly or your liver isn't metabolizing things the way it is fast or easily as it could. And then always, of course, follow directions on the label or box. Don't just dump a bunch of it in your hand and pop them. Okay. So, okay. So always check the label for multiple ingredients and only take what you need. So a lot of cough and cold medicines in particular, they might have a certain brand name that you recognize, and that brand name might apply to multiple different products. So always check the label. And some of these combination products have a lot of different meds in them that you don't actually need. So if you have a cold and a stuffy nose, you don't need the acetaminophen if you don't have pain or fever. You probably just need a decongestant or something to help your cough. And so you don't need all the products in that. They often just group them together, but you really just want to look at what's in there and take what you need. If you don't know, ask the pharmacist, because they can tell you. And we talked about how similar products can have completely different names, so always check the label. And don't buy just on the brand name. Okay, and then if you're looking to save money, you can always look for a generic option versus the brand option. Though the generic is usually cheaper and equally as effective. And if, like we said, ask the pharmacist if you don't know what a medication is in there. Yes.
So, I'm a name brand person, I think that is better.
You think it's better?
I just think it's better. They were the originator, they marketed it, they did the research, then you get the knockoff, so to speak. Is there any regulation that requires that the knockoff brand be equal to the original brand, or can they do whatever they want to call it, something that is not? And how do you know that? How do I know that if I go to Rite Aid, their brand is as good as Tylenol?
So, good question. So, and this is true for FDA approved meds, but if it's not like supplements that aren't FDA approved, that there's no answer for that. But for like FDA approved drug medications, for generics have to show that they're within about, I think it's a 10% effective range. So they have to show that before they can sell their product. So they are considered equally effective to the brand name.
So one's 100% effective, this one could be 90%, it's still then.
Well, it has to be like in that range of 10%. So there can be a little bit of variability, but it is thought to, or it is considered equally effective.
In general, they're making just, it's basically you're making a chemical, they just make the same chemical. So it's essentially the same. And obviously people could take the generic or they could take the brand name, that's absolutely your decision, but it's the same chemical.
So it could even be within 10% of a brand name, different competing brand names could be more or less effective within that brand. Is that right or not?
Yes-ish. I can't remember exact, like, the different brand, well, there isn't the same, there's not, well, there's one brand, the one brand name product that comes out, and then if another brand name comes out, it's usually the same class of med, but it's a different structure. And then the generics are all made off of the single brand name structure. So, yeah.
Oftentimes generics don't have as much garbage in it. They're cleaner without any other added ingredients.
That could be true.
It is.
So, yeah, there's differences in the non, I'm forgetting the word,
In their
substance that make up the pill or the liquid or whatever.
the other additives, the same.
That, yeah, the additives. So those can be different.
So what you're saying, I should remind that they're no namers.
Yeah, I mean, I always buy generic. Because I think it's cheaper.
Read the ingredients and
Yeah.
compare.
So I always recommend, I always use generics, and I always recommend generics because they're cheaper and generally they're equally effective. I haven't ever noticed that they're not. So. And then looking at over-the-counter meds, always look, there are high-risk meds over the counter, especially for patients who are older. over 65. So just because it's
Watch out.
over the counter doesn't mean that it's safe. So things like Benadryl, that's a common one that I try to counsel older adults to avoid because it can lead to falls and fractures and changes in cognition. You know, the ibuprofen, naproxen can cause bleeding. Same with aspirin. So watch for over-the-counter meds. And again, it's just a reason to tell your doctor what you're taking so they can assess. And also, this is something I have to tell people a lot, but anything that has PM on the label has diphenhydramine, which is for a lot of older adults, or anyone like to use diphenhydramine to sleep. But as you get older, that can have a lot of side effects, including falls and dizziness and fractures and things. So watch for the PM. And a lot of people are just taking Tylenol for the pain relief, and they take it at night so they think PM, but they don't even need the diphenhydramine portion. So always ask yourself these questions with over-the-counters. Do all of my providers know what I'm taking? Is there a good reason for me to be taking this? And is there a less expensive option available? Okay, so let's talk briefly about communication. So first of all, when should you request a refill?
Before you run out,
Yes, that's very helpful.
and always check to make sure that it says you have a refill remaining, because you have to wait longer for the call-in to have it reapproved and redone.
That's very good. So yes, call before you run out. Check the label, because if you have refills, you don't have to call us. You can just go to the pharmacy. I have a lot of patients sit through the phone tree, a long wait line, to say they need a refill, and all I say is, oh, it looks like you can just go to your pharmacy and get that refill. We give you refills. So I'd always say it on the label if you have refills left. If you don't have refills left, still go to the pharmacy, because they can send us a refill request that's often faster than you sitting on the phone requesting a refill. So the point is, try not to wait till the last minute. A lot of clinics will have a 72-hour turnaround time for refills, because that's how long it takes, the doctor to get to approving the refill. If you use mail order, you want to give yourself a little bit more time because they have to mail it out. And so how to request a refill? Start at the pharmacy. If there's refills left on your prescription, easy, they'll fill it. If there's not, they'll send a note to us to send a new prescription. And it's much faster. The other thing I always like to remind people is make sure you're requesting your up-to-date prescription. So sometimes people let's say they're taking their blood pressure med, lisinopril, and they have a 10 milligram pill, that's what they've been taking, and the doctor, we increase the dose, but they refill lisinopril based on their old prescription number. And so if that wasn't discontinued at the pharmacy, then you'll just get your old dose and you'll never get your new dose. So always make sure that you are requesting the most up-to-date prescription you can fill. We have some mechanisms that now to help prevent that, which discontinues the old prescription at the pharmacy when we order a new one, but a lot of places don't have that, or they might not have received the message, so just make sure that you're refilling the most up-to-date prescription. And if you're out of refills or expired, or a way to avoid that too is also when you're at the doctor's office, ask them to refill, send new prescriptions, because that can help. When you're there, it's just a lot faster to get it all sent in than calling later. Okay, so the thing I was talking about with refill management is MedSync. So a lot of programs, including our pharmacy here, has what they call MedSync, where they'll sync up all your meds to be refilled on the same date every month, which is, so you only have to go to the pharmacy one time. That takes a little finagling for the first month to get everything synced up, but after they're synced, then you only have one trip to the pharmacy.
That would be nice.
Yeah, so ask them, ask where you fill if they do MedSync. A lot of places will do that. If you need to move pharmacies, then just have your new pharmacy say, hey, all my prescriptions are at this Rite Aid, and they'll call a Rite Aid and they'll get them all transferred over. You don't have to call your doctor to get them moved. The pharmacies can take care of that. So I highly recommend the MedSync if your local pharmacy does that. Okay, so these are a few communication tips, but I'm gonna skip over that for time. And we'll talk a little bit about medication coverage, because this is confusing. So, I kind of separated into 5 different sections. And this is how I think about coverage. So you have commercial insurance. So that's usually through your employer. And they usually have tiered drug plans, meaning, well, a lot of them have tiered drug plans. But, so certain meds are cheaper, and then the more expensive the meds, the more that you have to pay to. And I point out here that under commercial plans, they have high deductible plans, which is great for people who don't have a lot of med costs, and don't take a lot of meds. But this bucket, if I have someone who needs an expensive brand name med and they have a high deductible plan, there's nothing usually I can do to help them, because they won't qualify for assistance because they have insurance. The copay cards don't take enough of the cost off, and so there's just not a lot I can do. So if you're someone who has a high deductible plan, which is great, just don't get on it. If you need a brand name drug, then you're going to want to probably change off a high deductible plan for next year. Or you plan for the cost, that's fine too. But, okay, then we have Medicare, so we have Advantage plans, which include your Part A and Part B plus your drug coverage. Part D plans, which you would get separate from your A and B. And then there's an extra help, so people who meet certain income requirements can apply for extra help through Social Security, and have very low drug coverage.
Under Medicare also, you also have the VA.
Oh, you're right.
limitations.
The VA also would fall in that group. So a lot of people forget, they just get their Part A and B and they don't get any drug coverage because they don't realize that A and B doesn't cover drugs. So if you have prescriptions and you're on Medicare, you're going to want to get an Advantage plan or a Part D plan if you're on a lot of prescriptions that you want help paying for. There's drug company assistance programs. So every brand name drug, that drug company often will always has some sort of assistance program. So they'll have copay cards, which decreases the copay each month, but that's only can be used for commercial payers, not government insurance. So no Medicaid and no Medicare. There's free trial cards. Those give you 30 days free. They can only be used once in your life. Medicare patients can use those. So I use those sometimes if I just need to get a patient started on a med, or they fall into the coverage gap and I just need help for a month. I might use one of those. And then there's the patient assistance programs. Those are usually for uninsured or Medicare patients who can't afford their copays or can't afford the drug in the coverage gap. And you can apply for these and they will usually cover the drug 100% if you qualify. So if you're on a brand name drug, know that there's ways to help make that affordable and to reach out to your care team and see what we can do. But all of these you can also just find online. If you Google the drug, go to the drug company website, there'll always be a section on savings and you can help get that started. Okay, so I'm gonna skip this because we're running out of time. But medication formulary. So do you guys know what that is when I say medication formulary?
To me, it means you have to try drug A first on the list, which is usually less ineffective, but before you can move up to the next more effective drug. Yeah,
Okay,
we'll try the
that's-
first one first.
I'm gonna add a little to that, but that kind of is on the right track. Any other thoughts? So the medication formulary, every insurance company, Medicare, commercial, Medicaid, they have a formulary of drugs. And this is a list of drugs that they've evaluated and decided that they're gonna cover for their people who have their insurance. And that list of drugs is a list of generic drugs and brand drugs, and it's developed by a committee. So there's providers, physicians, pharmacists on the committee, and they sit down and they evaluate the drug and look at the efficacy of the drug, the side effects of the drug, and the cost. And they decide which ones they're gonna prefer. And they also will usually negotiate with drug companies to get certain, like, lower costs, and then that's what they'll prefer, because if they can get the drug cheaper, then the patient's premiums are lower and overall healthcare costs are lower. But that also, and that can change throughout the year. So, like, for drug class, I think this is really popular in the news right now, but drugs like Ozempic, there's multiple drugs, and this is a diabetes drug, and there's multiple drugs in that class. Ozempic, Trulicity, Ribelsis, Victoza, all in the same class, work the same way, some variabilities in, you know, I guess how potent they are, or their side effects, or some of their other effects. But the drug companies will look at that and say, well, we need to control costs a little bit. So which one do we think is the most effective in balancing that with which one we can get the best cost on? And that's how they decide what their preferred drug is and what they want all their patients to try first, at least. And so that's kind of how the formularies work. So then the formularies have these tiers. So tier 1 is usually preferred cheap generic drugs, and there's little copay. Little patients pay very little for those. And then as you move up, you pay more for the drug. And then sometimes we start to see prior auths, because as they get more expensive, the drug company wants to make sure, the insurance wants to make sure that they're going to pay for this drug for the people who really need it and meet the criteria of, like, how it was used in studies and how it was approved. So you usually will start to see prior authorizations for, like, tier 3, 4, and 5 drugs, which means that we just have to, the doctor's office has to go to the insurance company, like, okay, this patient meets this criteria, they have this, this, and this, they meet your criteria, and the drug company's like, great, and then we'll cover the drug. Doesn't mean it's free, but they'll cover it at whatever tier it's on, and not copay. So this is a little bit explaining prior auths. The positives are they can control expensive, decrease inappropriate medication use, but the downsides are they're very time consuming, they take a lot of time, and can potentially limit access to certain meds for patients that need them. But I just wanted to explain this a little bit, because prior auth is a big deal. The clinic does a lot of prior auth. Patients are also involved with the prior auth, and you might hear your pharmacy say, oh, the drug requires a prior auth, we're going to have to contact your doctor. And that's what we're doing. We're looking at the criteria, or a lot of times the prior auth is just because we selected a drug that wasn't on their formulary. And we don't know what's on the drug company's formularies. Or on the insurance formulary. We try to educate ourselves, but it's hard. There's a lot of formularies, and they change. So, if there's a prior auth needed, know that we're working on it, and it can take a little time. This is a little bit about Medicare. I'm going to skip over this because I really just want to talk about this. Who understands their Medicare Part D coverage and how it works? If no one understands it, I get it because it's confusing, and a lot of us don't understand it. But I thought this illustrated it very well. And Medicare has a lot of stages of coverage, so it can be really hard to understand the cost that you see at the pharmacy.
That's why it's called a donut.
Yep. Because it kind of looks like a donut. So you start out every year, January 1st, and this applies to brand name meds. but you have to pay a deductible before Medicare is gonna pay for anything for a brand name net. And that deductible can vary from $200 to $500, depending on your plan. Once you pay your deductible, then Medicare is like, okay, they have some skin in the game, we're gonna help you pay for this drug. And that's when you go into your initial coverage phase, and that's where you pay your copay based on what tier the drug is on. So that could be for a preferred brand, $30 to $50 generally is a copay for a 30-day supply. And then, as you progress through the year and you fill your meds each month and you pay for the copays and Medicare pays the back end of the rest of the drug cost. Once you get to $4,660, you will drop into the coverage gap for the donut hole. And that's basically Medicare saying, okay, we've paid enough, we can't pay anymore for a little while, or we can't pay as much. So then you're responsible for 25% of the drug cost. So if you're on a brand name med, like one of the newer blood thinners, that could be like $120 a month-ish, 25% of the cost. And you stay in that coverage gap until you reach another amount of money that you've paid and Medicare pays, and then you drop into catastrophic coverage and Medicare's like, whoa, okay, you definitely paid a lot this year, we're gonna give you a break. And they come in and then your copays are very low, 5% of drug costs, until the end of the year. And then it all starts over again on January 1st. So, if you go to the pharmacy, let's say your doctor decides to start you on Ozempic, and you go to the pharmacy and the pharmacist tells you it's $300, just know that that $300 may just be your deductible, and you have to pay that once every year, the first time you fill it, and then only lower the next month. If you're only on one brand name drug, you might never reach the coverage gap. But if you're on 2 or 3 brand name drugs, you're gonna reach the coverage gap. So, any questions about that? I get a lot of questions about that. And people not quite understanding how that works. Okay. Well, I think those are the main things I wanted to cover today. So just quick summary of 5 ways to lower your drug costs. Switch to generics. Mail order pharmacies. Some insurances will give you a better deal if you go through a mail order pharmacy getting 90 days. Choose a plan that offers additional coverage in the coverage gap. There are some plans that will do that. Apply for Medicare Extra Help. And then if you have commercial insurance or Medicare, you can do the pharmaceutical assistance programs or look for copay cards if you have commercial insurance. So, with that being said, I covered a lot today, and I think I'm over time. What questions do you have? Anything I didn't answer?
I think you did good.
Yeah, very good.
Thank you. Okay, well, thanks for coming. It's